I'm in front of a doctor's office. Okay, this is a typical doctor. This is actually a doctor's office. So we're going to go in there, and then we will see what they usually do. Welcome. Come on in. So you have usually they have a computer here, and you ask the patient what, you always see this where usually it asks the patient to sit down. Okay. So I usually kind of comes in, I ask the patient, usually sit down. Okay, now we're going to go through a routine stuff. How do they usually measure the blood pressure? Okay, so I'm going to leave my hand, I'm walking to this is what any patient usually come in, you ask them to sit on this chair and you leave, you're going to leave your arm like this and you're going to get the blood pressure. So what I'm going to do is, I'm going to check my blood pressure and see what's my blood pressure reading with the arm lying down. Okay, it usually takes 1 to 2 minutes for actually it's back, it's 129/83. Okay, can you get the camera right there? Okay, now what we're going to do is I'm going to leave, somebody's going to support my hand and I'm just going to leave it like this, relax your arm and support the arm like this. Okay, and then see what happens. So I'm going to press it again and see what what kind of blood pressure reading we get by somebody supporting your arm and blood pressure reading, and is there a difference here? Okay, now we look at the blood pressure, 120/83. Okay, so clearly there is a difference when you do the blood pressure, somebody is supporting the blood pressure. So almost 10 millimeter blood pressure reading difference. So you should be concerned. So, okay, the reason the whole exercise we did, what a normal patient face when you go to doctor's office, right? When you go to doctor's office, who comes in? A MA. Or a medical assistant or a nurse usually come in, hey, how are you today? Let's measure your vital signs. That's what they call it. And one of the most important thing is the blood pressure. So they're going to bring in and, doctors, and then when the doctors come in, they will see the results. Very rarely a doctor come and measure your blood pressure. Okay, so what is the MAs are? Usually they're busy, they have on a daily basis, they may be seeing 30-40 patients. They're just going to come in. When you come in, you're going to put your hand right here in this way, and they'll ask you, sit on this chair and measure the blood pressure. So again, we're going to talk about the whole purpose is the recent study we published in JAMA. It's a great study. So we're going to talk about the importance of every physician, and also patient need to know when we make errors, we don't listen to the the evidence-based medicine. There's usually something wrong with it. Again, the arm position and the blood pressure reading, the arms crossover randomized clinical trial study. Okay, this is the paper, and it was published in JAMA October 7, 2024. It was published this month. Okay, very fresh article. Now, I think it's very important to recognize the primary author is Dr. Hairong Lee, Liu. Okay, and then the senior author is Dr. Ahmed Sabit. Again, it was published in JAMA. As we know, it's a very reputable magazine for evidence-based studies, JAMA. Now I'm just going to go through some of the things. So, mainly they were just looking at it different, when you measure the blood pressure in different setting, and there is a difference and all that, right? The objective of the study to determine the effect of the different arm positions and the blood pressure reading. Design of the study, there's a crossover randomized clinical trial, recruited adults between age 18 to 80. It was done in Baltimore, Maryland. They have, I think, 113 patients. So once they got the patient, they put them into different groups. Okay, they put 3 different settings. They measure the blood pressure. One was they asked the patient to put the hand on the lap, just like this. Okay, the other one, they come in, just ask the patient to put that without on the side. Okay, they also measured, they put a desk right there, and then, or like somebody holding, I mean, I think they put a desk. In this setting, they put a desk to measure my hand is like fully supported, so I don't have any pressure on my hand. Okay, and then they measured the blood pressure reading in all three different settings. Now, so what are the results? What they found out? There's a statistically significant reading. The readings were higher when you put the hand on the lap or on the side, okay? And the readings were more accurate when we put on the bottom line, that when you measure the blood pressure, the hand is supported, the blood pressure reading is lower. So the main results which came out of the study is, please do not measure the blood pressure like this or like this. Always have a desk or ask the patient to sit on a chair and then measure the blood pressure. Otherwise, it's going to overestimate, At least, in this study, they're saying overestimate by at least 4 to 5. In my, this clinical trial, I call it, maybe like a one patient trial, you see the big difference. It dropped by 9. Now, don't take mine, but always look for this is again, statistically significant study. This is the one exercise we did from my own experience. I was kind of telling you what's the blood pressure reading, but it's clearly shown, like, my initial blood pressure was like 9 millimeter high in the systolic, and there was a difference in diastolic. When I was fully supported by my colleague, the blood pressure reading was lower. So always ask the MAs or something, hey, can I sit on a chair? So I'm going to show you like another way of what you should do. So I'm going to say, so I'm going to put this up here. I come up here and I have a chair right here. So what I do is, like, this is what you should do. If you don't sit on this chair to measure the blood pressure. Okay, come up here, grab a chair and say, like, hey, ma'am or sir, can you check my blood pressure like this? Okay. So your hand is relaxed, supported by that. This is the best way to measure the blood pressure. Otherwise, you're going to come in, you got a higher reading. What the doctor is going to do? Doctor doesn't have the time to ask you, like, hey, when was the last time the doctor asked you, like, hey, did you measure the blood pressure? Was the hand like this, or a hand like this, or a hand like this? No, doctors don't have the time, right? They're seeing like 30, 40 patients in these days. So if you don't see a minimum like 30 to 40 patients, they don't make any money. Especially, that's why a lot of people don't go into primary care. That will make another presentation. So the only thing, my recommendation, again, evidence-based study published in JAMA. When you go to the doctor's office, go there relaxed, okay? Take your time and then sit on a chair before they make the blood pressure reading. Put your hand, get it relaxed, and then ask them to take the blood pressure reading. And you should ask them, like, if somebody is getting like one blood pressure reading, you can say, like, I would usually say, like, hey, can you measure 3 times and give me an average of like what is happening? That's what we should do, okay? Thank you so much for watching. This is a great way to learn evidence-based medicine into our clinical practice for the physicians. For all my patients, or like, who I couldn't say, like, a lot of people in the United States have blood pressure, right? Maybe we are overestimating when you go to doctor's office. So it's very important for all of us to, especially the clinicians and also the patients, or anybody who check the blood pressure. Even when you do like blood pressure reading at home, you should know like what's the position, okay? Just put your arm, very fully supported, relax, get 3 reading, get 3 averages of that. Thank you so much for watching today. God bless.